This is a case of a very aggressive recurrent pterygium that was referred to us. Again, all my principles are delineated here: intralesional anesthesia, opposite limbus fixation suture with a 7/0 black silk. You can see the lesion here with extensive involvement of the cornea and multiple conjunctival scars with phonics involvement. Again, I start dissecting like I do. Separate the conjunctiva from the lesion, save as much conjunctiva as you can. You see the marks I have already placed to determine the cosmetic opening of the primary eye position. And now I start tracing the tentacles like I've discussed in my previous videos to get the entire lesion in my left hand, and you can see it separating very gently. And again, even with this extensive growth, there's literally no bleeding, as you can see. So keep on getting your tentacles and the entire lesion with you. At the cornea, never cut, peel the scar away from the cornea so you don't induce any astigmatism and you get a gentle Bowman's membrane right there. Entire lesion sent for histopathology. Using the 64 blade again at fast movements. Of course, this is even more expedited to make sure I get a nice clean sclera, limbal, and corneal area. Accept the amniotic graft. Place it here. Cut the excess of the amniotic graft. I do notice a foreign body in the angle under the graft, so I'm going to look for it by reversing the graft. Again, be very meticulous. Do everything you want during surgery. Do not assume things. Now that the graft is clear, I don't see any foreign body underneath. I'm going to slide it back in place. I've just used it to seal glue. And make sure, pull the graft right onto the medial area to cover the medial rectus. Make sure in this extensive dissective area the graft is completely covering the area of surgery. Lay the conjunctiva over. Make sure it's nicely adherent. Squeegee everything around. Make sure it's cosmetically very appealing and functionally excellent too. Using the 2-whack technique to ensure the good adherence of the graft with glue. Remove excessive glue from the surrounding phonuses. Here we are with my final amniotic cut. And as I pull this away, we can also determine adherence of the remaining graft. Here we are, remove excess glue from the cornea so there's no irritation next day. And here we are